Hello, Dr. Lynch. This is Jenna McWhite, and this is my Piece 490 first internship project, side service project. So I did my internship at Prisma's Prosthetics and Orthotics Center on Bear Drive, and for my project, I made a pamphlet which addresses the importance of sock wearing socks with your prosthetic leg. So with prosthetics, the patients have a liner over their residual limb, and then the prosthetic clicks into this liner. And so a lot of times with the new amputations, the patient's limb fluctuates in shape and size, so their limb will either shrink or sometimes even swell in the healing process of their amputation. So some reasons why the limb might increase are due to the trauma, impaired lymphatic damage, and also just keeping the limb in a hanging position. Gravity will cause it to swell, and then it can also shrink because of muscle loss, changes in the soft tissue, and fluid shifts in the leg. So a lot of patients, when I talk to the clinicians at the clinic, they didn't really understand that while their limb changes shape, their prosthetic leg doesn't change to accommodate this change. So they thought that it was important to make a pamphlet or some kind of flyer which addresses this, since a lot of the patients who do have amputations are diabetic patients who are non-compliant with their healthcare workers in the first place, so that it's like a reminder that they can take home with them and be like, hey, if this isn't working, do this. So I made a pamphlet for them, and in the pamphlet it includes like what socks really are, the importance of socks, and when you should add or remove some socks. So this is just a general idea of what the pamphlet looks like. I'll go into details over it later. And so on the front, it just has Prisma Center for Prosthetics and Orthotics, and then the importance of sock wear. And then on the back, it has their contact information, so their name, their address, 50 Bear Drive, Cranville, their phone number, and then a website that people can go to if they have any questions. And so right when you open it, it goes into the concept of a sock, and it says, with your new amputation, your limb is going to fluctuate in size on a daily basis. While your limb changes in sizes, your prosthetic does not. So to ensure proper fit, there are prosthetic socks to accommodate these changes. This just goes over the general idea of what a sock is and kind of the importance of it. And so then right here on the next page, there are 4 bullet points which address the 4 main importance of socks. So number 1 is skin protection. Socks are very valuable, important to protect the person's skin. It reduces blisters and breakouts, which is really important for diabetic patients, since most of the time they do not have a lot of them have vascular problems, so this will help keep them from experiencing these issues. And then number 2 is fit adjustment. It allows the prosthetic to fit when your limb changes in size. It would be really hard for clinicians to change the prosthetic every time you're fluctuating, and you can fluctuate throughout the day on a daily basis, whether you're up and moving a lot throughout the day, or if it's hot outside, you eat a lot of sodium, your limb might change in size, where your prosthetic is a built thing, it's made out of carbon fiber, it's not going to change its size. So this, you can add socks, take socks off throughout the day to ensure that your limb fits in the prosthetic properly. The third most important thing about socks is it is an even pressure distribution within the limb. It's going to make sure that your limb is evenly distributing pressure from the back, front, side, bottom, just to help with the skin protection, blister breakouts, and all that stuff. And then number 4 is cushion enhancement. It's going to add an extra layer of cushioning to your prosthetic to help with this. So besides the liner, you're going to have another cushion on top of that before the prosthetic goes around it. And so that's like the first page of it. So it opens like that, and then you'll open it again. And so on this one, we talk about sock ply. it says prosthetic sock different plies or thickness to them. The thinnest size is a 1 ply, then there is a 3 ply, which is the median, and a 5 ply, which is the thickest sock. Depending on how much your limb has shrunk, will depend on the ply and amount of socks you will need to wear. So, in this picture, you can kind of see that there are different colors to prosthetic socks. So, there is a sock ply, and most of the time it's 1, 3, and 5. So, a 1 ply sock is the thinnest ply. Ply is like the thickness, the amount of strands that are in the sock. So 1 ply will be thinnest, then you'll go 3 medium, and 5 is the thickest. And most of the time it's like they will come in a pack with about 3 5s, 3 3s, 3 1s, something along those lines. And a lot of patients, they will work their way up and they can have like a 5, a 3, whatever suits them best. Most of the clinicians, when they are making prosthetic, try to increase the mold of their leg so that it is a 3 ply sock, just so that if the leg does swell, that they will have some kind of wiggle room to make sure they can always get in it. And then on the last page right here, it's a little chart kind of when to add a sock or when to remove a sock. So some important times to add a sock. The first one is when there is pressure in any of the bony areas. So this could include on the top of your patella, like near the patellar tendon, your tibia, fibia, and fibia, and on the bottom part of your stump. You don't want too much pressure on these bony landmarks because that can cause pain as well as other issues, maybe blisters and breakouts. So it's important to add a sock then. Another time when you should add a sock is when the redness, if there is redness that appears, that doesn't go away in 30 minutes. So it's important to check your limb, especially after you get a new prosthetic, and if there's issues with your prosthetic. So if you take your prosthetic off and you see that there is redness and notice that, you need to start looking at it. And then if it doesn't go away within 30 minutes, you need to add a ply or go see your healthcare provider because that's not normal. And then the third one is if your prosthetic twists when you stand or walk. So when you're standing up and your leg's in there, if you can twist it, then that's not a good sign. That means it's too loose. So you need to add a sock. And then the last time, these are all just general guidelines, just to add when to add a sock. The last one is if your prosthetic goes in too easily to the socket, and what people will tell their patients is if it clicks too much. So most systems are a pin click method. So they have a pin and it goes into like a hole and it clicks. So you'll hear like click, 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 and there's 6 of them that you should hear. And the general guideline is you want 3 to 4 clicks to make sure you're safe to walk. So you don't want it to go right in. So when they'll tell you this when you're trying out your prosthetics, so they don't want it to fastly click in. They want you to have to work to get it in, just to ensure that the pin isn't hitting the bottom. So, because that can cause issues with the prosthetic leg. So if your pin clicks too fast when you go in, you want to add socks just to make resistance and make sure it fits properly. And then on the other side, there are times when you need to remove your prosthetic, but it's a lot less times than when you need to add. So one of them is if you can't get your leg fully into the socket. Again, hearing the clicks is important to make sure your leg is fully in the socket. This will be about 4, 5, 3 clicks. You don't want 1 or 2 because then it's unsafe to walk. Really, you don't want 3. It's mostly 4 to 5 is that number you want. And then the last time is if the socket is unbearably tight. You don't want to be wearing it then. So those are also just general guidelines. Like I said, after wearing the prosthetic for a while, you will know what you wear and what feels right to you. And so with this pamphlet, the idea is that the clinicians can give it to patients when they get their new things. They're going to be like, this is about sock wear. You just got it, so your limb hasn't changed too much since we have measured you. But if you feel that your limb is shrunk or anything, here's this, and take a brief look at it. If you have any questions, just get back to us. It's just a general guideline so that patients will be more compliant with their clinician, so that they can know how to use socks, know the importance of them, and hopefully not have any questions, or to reduce issues with compliance altogether. And a lot of patients, once they figure out the importance of software, they say it's a game changer for their prosthetic, because they do realize that every day they're going to wake up and their limb won't be the same as the next day. Whether it is from blank activity, they've been doing more muscles, like walking, so they're gaining more muscle, so it's different than it was before, or they just have a heavy meal on sodium. It'll change in the day. So this is the Panflict I made, and there's the front, there's the back, just some pictures, and there. And I have included a PDF of this. It will look more like this to my site service project overview document, so you can take a look at it if you want a closer look. I know it's hard to see it on paper when I'm like this, so thank you so much. Bye.